This individual has more subtle abnormalities to her nose. It's crooked because it's projecting somewhat to the side. You can see that in the unevenness of the nostrils. She also has a fairly large tip. Once again, we see how we tend to notice her eyes and lips more in the after picture. A little more nostril showing is very natural, but the tip, the bridge, and the nostrils all seem to make a very natural configuration. Rhinoplasty in men is generally intended to produce similar improvements in configuration, airway, and breathing. Here we see a nose that's quite crooked and twisted, as well as tip cartilages that are very prominent. After correction, the bridge is smooth and straight, the tip is one unified tip structure, and the nostrils are more even. Again, the nose is a little smaller and fits in more naturally with the face. There is a tendency of rhinoplasty in nose surgery for noses to end up somewhat the same, in that at the end of surgery, most people want a smooth, straight bridge, a fairly small tip, and a good tip position. That's why after surgery, so many people in the news and the media all tend to look the same in that regard. Here, his prominence of his bridge and the crookedness is a little more obvious, as are the uneven, asymmetric attachments of these lower cartilages. Again, after correction, we see a balanced, harmonious facial features. Sometimes the changes are smaller and more subtle, but very effective. Here we're just removing a smaller bump and correcting a relatively finer tip bulbosity. Once again, the nose is less distracting and more harmonious with the rest of the face. Here's a good example of the C sort of profile that is evident in patients before rhinoplasty, in which the nose is projecting out and somewhat a little bit of recession of the chin produces this kind of curvature to the profile. After rhinoplasty, the nose is now fitting in the profile, and the profile is much straighter. Here we see someone with a naturally very depressed and weak bridge. After placement of an artificial implant, the bridge is now smooth and straight. It is now balanced with the tip. This sinking of the bridge, also called a saddle nose deformity, is evident in this side view. Here we see it corrected with an implant. Sometimes after surgery the nasal bones do not heal together well and produces this wide open bridge deformity. With revision surgery this can be corrected and the bones brought back to their normal position.